They are some of our downtown neighbors. From the Center for Family Health, Chief Operating Officer Sarah Benedetto, along with women's health providers, we have Dr. Dana Virgo and nurse Missy Ferlet-Koski. Good afternoon.
Hi, Barb.
All women to talk about women's health today.
That's right.
Yeah. First, how's everything going with the new temporary clinic?
It's going very well. Things are just, it's almost like there was no change other than the location.
Yeah.
But patients are finding us, and yeah.
How's the construction going?
Really great. We, on Friday, you started to come up out of the ground, so the steel beams are getting installed, and all the demo work is done inside. A little noisy right now, but it's all good.
Still on schedule for fall?
We are. Keep your fingers crossed. So far, so good. We hope to be completed by early fall to move in, maybe September-ish.
Nice. Well, I'm glad we're talking about women's health because in February we have Women's Heart Health Month being observed. And when you think back to the founding of the Center for Family Health, I think women was in the title of the center, wasn't it?
Well, it was Center for Healthy Beginnings, but it was all about access to care for women, particularly women of childbearing age, but we also did some GYN services.
Yeah, and ever since then it's been a focus. And I think when the center started, Jackson had a shortage of OBGYNs.
Yeah, actually, when the center started back in 1991, it was a result of a community collaborative where they were looking at why Jackson County had such a high infant mortality rate. Highest in the state of Michigan, highest county in the state of Michigan.
Wow.
And what was identified was that there were not enough providers that accepted Medicaid or would see women that were uninsured. And so we filled that niche, and we opened in 1991, and our model was a nurse midwifery model. We had physicians as well.
Well, yeah, and today we're going to talk about midwifery, and I've been mispronouncing it all these years, but I don't really say it that much.
Many people do. Yeah.
Yeah, so you're a midwife.
I am a midwife.
And
yes.
you practice midwifery.
I do practice midwifery, not midwifery, which is how some people mispronounce it.
All right. And you're new.
I am brand new.
Yeah.
I'm like 3 weeks in.
Well, welcome.
Thank you. I'm happy to be here.
How's it going so far?
It's great. Yeah, there's a high need. I mean, folks really need good care in Jackson, and we have plenty of patients to see. So I'm busy, but it's a good busy.
Well, first, for those who aren't familiar with what a midwife is and does, can you fill us in a little bit?
Sure. So there's different kinds of midwives, but the kind of midwife that I am is that I'm a registered nurse that went back to school for a master's degree in nurse midwifery. So I'm like a nurse practitioner, but my specialty is maternal and fetal health.
So being a midwife, you're there at the birth, right?
Correct. Yeah, we actually provide care across the lifespan, so I can see people for their annual exams and do things like pap smears and breast exams and that sort of thing for folks that are in contraceptive care, for folks that are younger or people that are menopausal or postmenopausal age. Most people know us for baby catching or delivering babies and taking care of pregnant people, and so that's also a big part of what I do and what I love about what I do. So we do prenatal visits, and I attend births and do postpartum care. I'm not a surgeon, so that's one thing I don't do.
No C-sections.
No.
So,
I have
That's
physician
Dr.
colleagues who do that for me.
I always thought, midwife came about because there wasn't a doctor on every corner.
Sure. To the contrary, actually, midwifery is the oldest profession.
Really?
Yeah.
Well,
so
the oldest profession?
The oldest profession.
Oh, so that clears that.
Yeah, that clears that up. I mean, we've been community health workers since the beginning of time, and so it fits nicely into the center's model of care to be a community resource. And so a lot of folks know midwifery because of home birth, and some midwives do home births, but actually about 96% of certified nurse midwives are hospital midwives. So we catch 9 to 10% of the babies in the United States a year.
Catch.
Yes, because I'm not delivering the baby. The pregnant person is.
You're catching them.
I'm catching them. It's a real catch and release. We catch and then we give them back, put them skin to skin, promote breastfeeding, do things we know that will help.
So Dana, you've been at the center for 17 years.
17 years.
How have you managed to avoid coming on the show all these years?
I don't know.
What is having midwives and other OBGYNs and focus on women's health at the center do for the statistics that Sarah talked about earlier in the show?
Well, having care for women, especially uninsured women or women with public insurance, has been really important in terms of improving health outcomes here in Jackson. And thankfully, infant mortality has fallen, although it remains higher than what we'd like to see. So we have a lot of patients, pregnant people who have been looking for midwifery care. We have not had midwives at the center in some years now. And so some of our patients in the past have left Jackson County to travel to Ann Arbor looking for a midwife to care for their pregnancies. And that's not ideal because Ann Arbor is a bit of a hike away. So we're really, really happy to be able to offer midwifery care again at the center with its kind of very patient-centered, woman-centered philosophy.
Yeah, and I would think if I was, a pregnant woman, 45-minute or hour drive when you're pregnant, that's too long.
It's too long.
It's too long.
Yeah.
Yeah, especially when a baby is on its way.
Yes.
Did people, with moms not seeing doctors or having any kind of prenatal care, was the hospital when they showed up to deliver, was it the first interaction that pregnant women had?
So yeah, in some cases, what we found, what was happening back before the Center for Healthy Beginnings opened, was that about 400 women a year were traveling to Ann Arbor, and it was pre-electronic health records, right? So that meant that if they even were getting care in Ann Arbor, but didn't make it there to deliver, then showed up here at what was then Foote Hospital, the healthcare team didn't have access to their prenatal records because that was back in the day where you had to wait for the fax, or pre-faxing, right? You had to, before that was even a thing. So even if women did have care, the healthcare provider didn't have access to their healthcare records. But of course, many women had real sporadic care because driving all that way, especially for a population that already has a lot of additional challenges, like I don't have transportation, I have to rely on my friend or my neighbor. Now I got to get them to take me to Ann Arbor. So it was sporadic.
And I recall from our past conversations that lower income and minority moms were often not getting the care that they needed as a mom-to-be.
Sure, and we still are seeing that even today. So Dr. Virgo mentioned the infant mortality rate, and it's come down quite a bit. It's not, I can't rattle off the data right now, but it's not where we want it to be, and there still is a disparate impact between health outcomes for black babies and for white babies. There's way too much of a gap there, and so we're really working hard to make sure that we can do what we can to help close that gap and make sure everyone is welcome at the center, and that we meet people where they are, and then we take it from there.
Missy, do patients ask for a midwife, or how do you guys get matched up with mom-to-be?
That's a good question. Right now, my schedule is a little bit more open because I'm a new provider, and some patients, have been seeing Dr. Virgo for 5 years in their last baby, so they might choose to have her. But other folks have been requesting midwives, so they're excited to see me because I'm, a lot of folks are already pregnant, and so I might be seeing them in the middle of their pregnancy. But from now on, they could schedule their first visit with me. And see me, but we do share patients at the center, and so it's a collaborative model. So that we're bringing on another midwife in the summer, and so it is expanding. But we all share kind of the same pool of patients. So patients can self-select to see providers that they want, but we all do share because we share call. So when we will be delivering babies, it's whoever's on call that day. It's not that I'll go in and what we call specialing our patients, where we go in for particular deliveries.
And people have seen you, they know you if you're going to show up at the time of birth.
Right.
Delivery.
And that's why they, rotate through, because we don't know who's going to be on call.
And some C-sections aren't planned.
Correct.
That is
And
correct.
I can take care of laboring people up until the point where we decide we need a C-section, and that's part of the kind of collaborative model of care that midwives have, is that we practice with other people that can do surgery if we need it, or an assisted delivery like a vacuum or forceps delivery. So we work together, but if it's a normal delivery, then I do those. I do inductions as well. Some people think we only do like unmedicated, normal birth, but I support people in whatever birth plan they want, whether that be with medication or not. So
And are there still such a thing as home births?
there are, yeah.
I would imagine that is there a greater risk, or having a midwife at a home birth reduce the risk that it's?
I think having a skilled provider at a birth is important no matter what the birth location is. And so the things that I think about are like where would you be transferring to if there were a complication? And then also, does that person have the authority to give medications or start an IV or handle an emergency that's not in a hospital? So I think that home births are safe for people that are with providers who know, who are skilled at what they do. But I don't advocate for having births with folks who are unskilled.
No, I agree. I'm not a medical doctor or anything, but I would say that it makes no sense to go through that kind of a risk when we have the care right here.
Right.
Yeah.
And we're accepting patients, and we want to be there for those folks that need us. And like Missy said, we're really excited because we have a second midwife already set to join us in mid-June. I think it's like June 10th or something like that is her
that.
start
Wow,
date.
that's neat.
So that's really great news for.
So Dana, why did you choose women's health as your specialty?
Well, I always thought women's health was the most fascinating of all the health specialties, and I always just really enjoyed working with women. So it's been very gratifying, always interesting, never boring, never a dull moment.
And Missy, I could tell the enthusiasm that you have for women's health as you described your job.
Yeah, absolutely. It is never boring. No.
Well, we appreciate having you guys on our show. Welcome to Jackson.
Thank you.
And happy Women's Heart Healthy Month.
Thank you.
Thank you very
Thank
much.
you very much. Thanks for having us today.
Good to see you.
You too.
The COO at the Center for Family Health, Sarah Benedetto, along with Dr. Dana Virgo and certified nurse midwife, Missy Follett-Koski.